Hello, my name is Dr. Neal C. Murphy. I'm a periodontist in Los Angeles, California, and for 30 years I taught periodontology and the basic science related to periodontics at 4 major universities. Recently I stumbled upon a very startling article in the Journal of Obstetrics and Gynecology, a medical journal. I was very curious about it, but then I realized these findings in this journal article were very important for everyone to know. They were published by a colleague of mine, and I think you'll enjoy not only the content, but also the method of analysis. I'll try to be a good teacher. Here we go. My favorite articles that came out in 2010, Term Stillbirth Caused by Oral Fusobacterium nucleatum. That's by one of my colleagues at Case Western Reserve, Yiping Hong, a Chinese PhD in microbiology. A child in the womb of a pregnant mother died from periodontal disease spreading to the uterus. And here's the article we will be analyzing tonight. The Obstetrics and Gynecology Journal, it's a medical journal for OBGYN doctors, published this in 2010, and then it was repeated for the internet in 2011. It's by Yiping W. Han, a PhD in microbiology and authority in oral infections, and with a number of other authors. So these are corroborating and collaborating doctors. The title here, Term Stillbirth, means the baby was born dead at the end of the normal gestational period. This area here is important. Repeating here, it says that the same clone of this bacterium that killed the baby was located in subgingival plaque. That's the collection of bacterial colonies that thrives underneath the gum line. But notice also, through DNA analysis, the gold standard for scientific proof, these bacteria were not found in the supragingival plaque, that is the bacteria that float around the mouth, the vagina, or the rectum, close contaminant sources. So it's pretty well proven that gum disease disseminating from subgingival plaque, gum disease, can kill a baby. That's fact. Part 4 of this scientific analysis, let's look at the actual scientific method. Here we see in the methods portion of the report, the patient reported excessive gum bleeding during her pregnancy. Now this is something that's actually diagnosed by the patient. Here on this next page it says that pregnancy-associated gingivitis was the diagnosis because as we look up here in this report, there were actually no signs of periodontitis. That means that there was no bone loss. Just so simple gingivitis seems to be the culprit here. That's quite amazing. Here we see actual photographs of the placenta that the pathologist took. These small little blue dots represent inflammatory cells. These are the things that cause your finger to swell when an infected splinter gets into your finger. That's a typical response to infection. Here we see the same thing, even more densely illustrated. This is illustration B. We see that this problem of gum infection was also printed back in 2006 and 2009 by Dr. Han. So these data are not anything particularly new. This is the slow pace of science. And now let me finally show you some of the pictures of the tissue under the microscope so you can understand exactly what's going on. You can see it for your own eyes. The diagnosis was pregnancy-associated gingivitis. Remember, if you have gum disease in the bone, periodontitis, you've also got gingivitis. They used what's called a PCR, analyzing sections 16S and 223S of the RNA genes. And polymerase chain reaction is the definitive test used for scientific veracity if you wish to establish causation of a bacterium causing an infection. This is the same kind of DNA analysis you hear on television, the same kind of DNA analysis that we used to prove guilt in the O.J. Simpson murder case. Notice that in our illustrations here, figure A is Decidua capsularis. Sorry about the fancy terms. This is A, and this is Decidua basalis in illustration B. This is the one that had even more inflammatory cell density than the first one. This is what actually those represent. If you look very closely here, you'll see that Decidua basalis, the one where we had the really dense inflammatory cell reaction to infection, is right here, and in illustration A, Decidua capsularis is this here. There's the baby. There we are. There's the anatomical schematic. Here are the histological sections that we see under the microscope as scientists. We know that we've had this data since 2006, 2009, and here's the citation. So let's look it up yourself. If you have any further questions, or call me in Los Angeles. I'm at 818-905-5050. My website is universityexperts.com, as you know, and go to Google, type in Han stillborn, and you can read the article yourself. Isn't it about time we start taking gum disease and gingivitis a little more seriously? Shouldn't we stop trivializing it? I know I'm going to take it a lot more seriously in my practice. I hope this video series has been helpful to you. Thank you, doctors, for listening. Thank you, ladies and gentlemen.